Okay, class. Now, this is a continuation from the last class. Some of the things that through the World Health Organization, things that have been able to be accomplished. Now, selected achievement found in the Millennium Development Goals. One, extreme poverty has declined significantly over the last 2 decades. The primary school net enrollment rate in developing regions have reached 91% in 2015, up from 83% in 2020. No, and up 83% in 2000. Now, many more girls are now in school compared to 15 years ago. The developing regions as a whole have achieved the target to eliminate gender disparity in primary, secondary, and tertiary education. The global under 5 mortality rate has declined by more than half, dropping from 90 to 43 deaths per 1,000 life births between 1990 and 2015. Since 1990, the maternal mortality rate ratio has declined by 45% worldwide, and most of the reduction has occurred since 2000. New HIV infection fell by approximately 40% between 2000 and 2013. From an estimated 3.3 million cases, the zone that messes up the climate has been eliminated, and also official development assistance from developed countries have increased by 66% in real terms between 2000 and 2014, reaching 135.2 billion. So all of these statistics will not be taking place if all the member nations and also the respective countries did not do or stick to a plan that was developed by the Millennium Foundation Development to at least address some of these issues. Again, poverty declined, and most of the time because, as the education level increases within countries, most of the time the poverty level declines because more skills, people are able to gain jobs, And more skills, there is this world business, commercial, wherein different countries do export, import transactions, and that can help. And again, the primary school enrollment is extremely very, very important. When you have an educated population, you have a better chance of really increasing or advancing development. And when education improves, most of the time the quality of life improves. And hopefully, the government improves. The government focuses on the needs of their people, not so much as the needs to keep them in power. You see, because if you take care of your people most of the time, there's no need for people to take you out. But when you don't take care of your people, that's the time it's very difficult for people to keep you in power. And global under 5 mortality rate has declined because one, okay, there is vaccination, two, improved sanitation, three, improved nutrition. See, those things, everything being normal, vaccination, improved sanitation, and nutrition, and also mothers being educated as to how to take care of their kids. Some of those basic things. When mothers are healthy, most of the time, kids are healthy. And when they are not healthy, it becomes a challenge. And with necessary vaccinations, kids have a better chance of surviving the first 5 years of life. Same for mothers. Healthy mother, healthy pregnancies. Because most of the time, when the pregnancy is not healthy, most of the time the mother is not healthy, and very, very likely the infant will not be healthy. Better care, people know using condoms, and also proper medication. Now, the new HIV infection fell by approximately 40%. But at times, we also have to clarify some of this is great. But when you look at the HIV infection within African American women, it's on the rise. So there's still some work to be done. How can we prevent our African American women from contracting HIV? Maybe men have to be responsible. Men have to make sure that they wear the protective gear, wear the condom properly, and also do not share needles or bodily fluids, because these are the ways that the HIV virus is passed on from one person to another. And there's a level of giving among countries with more wealth. You see, because they are giving more to help those on the developed countries to build schools, to build hospitals, to provide all those basic services that people need. for them to advance. Provide clean water. Help them develop farms that they have enough food to take care of themselves and their families. All of these things are extremely important. Now, here are some of the okay, these are 17 substantial development goals. End poverty in all its forms everywhere, goal one. And end hunger, achieve food security, and improve nutrition, and promote sustainable agriculture. See, and these are all very, very good and things that needs to be addressed. Ensure health lives and ensure healthy lives and promote well-being for all at all ages. Ensure inclusion and equitable quality of education and promote lifelong learning opportunities for all. Achieve gender equity and empower all women and girls. Ensure availability and sustainable management of water and sanitation for all. Access to affordable, reliable, sustainable, and modern energy for all in terms of electricity. And not only modern energy, but also provide opportunities for internet, the broadband base, the Wi-Fi. Promote sustained, inclusive, and sustainable economic growth. Full and productive employment and decent work for all. Now, some of these things you might think they are only good for developing countries. But some of these things, with some of them, to a certain degree, we have some people here in America that could use the benefits of some of these things, even though they are in the most powerful, the richest country in the world. There are still need to promote sustained, inclusive, and sustainable economic growth, full and productive employment, and decent work for all. Again, some of the health disparities that people experience in this country can be explained by goal number 8, wherein the economic inclusion is not there for some people. Sustainable economic growth is not there for some people. Full and productive employment and decent work for all. For some people, you can say that there's still more that needs to be done. Even the idea of people, there's still the debate wherein people should be paid a decent salary for the work they do. Some people might be working for 40 hours a week and still cannot afford to have a roof under their head because of the hourly wages. So now, even now, here there's a debate about the $15 an hour, maybe with 40 hours work week. Maybe that might be able to produce that, but again, it's a work in progress. Build resilient infrastructure, promote inclusive and sustainable industrialization, and foster innovation. Again, infrastructure has to be built that is inclusive, and also for some form of industrialization. Because most of the time with some of this industrialization can promote innovation. People are very smart when given the right opportunity, the right climate for them to be innovative, for them to be creative. See, innovation is not only in the hands of one group. If you go back into history, a lot of great innovations have come from other minority groups. And today we are all good, we are all better for it. So most of the time, it's a disservice that we do to ourselves by not empowering others to be able to really have the opportunity to develop, to be creative, because whatever they create will be beneficial to all of us. Reduce inequality within and among countries. Make cities and human settlements inclusive, safe, resilient, and sustainable. See, settlements where people live should be safe, should be resilient, and they should be sustainable. Keep it in good condition. Ensure sustainable consumption and production patterns. Sustainable consumption, what people eat, use, in a productive pattern. Take urgent action to combat climate change and its impact. You see, the goals, the outcomes, wherein the ozone are almost eliminated. That in a way contributes greatly to dealing with the climate change challenges. Conserve and sustainably use the ocean, sea, marine resources for sustainable development. At times, people exploit, they go kill some of those like sharks and other things that are so important for the ocean, for their own consumption or their own pleasure, and also use the ocean as a dumping ground for waste. Again, you pollute the ocean, you create a situation wherein life in the ocean will be depleted. and that can also affect us. So therefore, we have to make sure we use the oceans in the best way possible, the seas and marine resources, as we continue to develop. Our development should not be based on depleting or making the oceans filthy or throwing some chemicals into the ocean, because when the ocean is polluted, some of the food source that we go to the ocean for might not be there. Or if they are there, they are filled with so many heavy metals, which might not be good for consumption. Keep the ocean clean so that we get clean fish, clean crabs, clean salmon, and we like those things. But if we continue to destroy their habitat, then we might be going out of those things that we like. Or if we further go there and get them, we might be eating certain things that can be very harmful to our health. So if we enjoy marine seafood, we have to make sure that the sea is clean. We don't use it as a dumping ground for all sorts of waste that might pollute the ocean. Promote peaceful and inclusive societies for sustainable development. Provide access to justice for all, and build effective, accountable, and inclusive institutions at all levels. Again, when countries do not provide those kind of things for their subjects, their citizens, one of the first things that they will start to experience is poor growth, poor economic development. And most of the time, what happens is they experience brain drainage. Most people who have the opportunity to leave those countries will leave. And there's a brain drainage. Because if you create an environment wherein people want to stay and contribute to their country's development, the system has to be conducive for that. So governments have to create peaceful and inclusive societies that can be conducive for development. And also justice for all, social justice for all. And you build effective, accountable, and inclusive institutions at all levels. Okay, some of this, again, we are dealing with some of this aspect in our very country right now, with all our development. But to use some of this for all is still in the minds of some people is seen as being offensive. But if there is going to be justice, it has to be for all. If there is going to be sustainable development, it has to be inclusive. And we also have to build effective, accountable, and inclusive for all. See, because when one group has all the advantages and the other group does not, that in itself is really not. You're not really promoting anything. You're not promoting peace. You're just creating problems. Strengthen the means of implementation and revitalize the global partnership for sustainable development. You have natural health agencies, national health agencies. Each nation has department or agency within its government responsible for protection of health and welfare of its citizens. U.S. primary national health agency is the Department of Health and Human Services. The HHS is the Department of Health and Human Services. So in America, who is the one that is responsible for the health and welfare of its citizens is the Department of Health and Human Services. Other federal agencies contribute to health, such as Department of Agriculture, the EPA, which deals with the environment, OSA, which also deals with safety, now the Department of Health and Human Services, headed by the Secretary of Health and Human Services, appointed by President and is a member of his cabinet. 25% of the federal budget, the Department of Health and Human Services has about 25% of the federal budget. And in fact, it is the largest department in the federal government. New healthcare reforms laws provide series of new duties and responsibilities for HHS. Organized into 11 operating agencies, 10 regional offices. So the Department of Health and Human Services, that is, first of all, is the department that is responsible for the welfare and the health of all Americans. And the head of that department is the Secretary of Health and Human Services. Now, the Secretary of Health and Human Services oversees a budget of 25% of the federal budget, which is the largest department in the federal government. At times, new healthcare reforms are also housed in the Department of Health and Human Services. Organized. Now, this Department of Health and Human Services is organized into 11 operating agencies and 10 regional offices. Organized into 11 operating agencies and 10 regional offices. Now, some of this in here, you can see if you you look at the flow chart, you have the secretary, deputy secretary, deputy secretary, chief of staff. Then you have all this being distributed to various parts of the country. Now, 11 agencies and 10 offices. Now, operating agencies of the Department of Health and Human Services. These are the operating agencies. You have the Administration for Community Living, Administration for Children and Families, Agency for Healthcare Research and Quality, Agency for Toxic Substances and Disease Registry, Center for Disease Control and Prevention. So this is extremely important for, especially for public health. This is where we fall. We fall under the Centers of Disease Control and Prevention. And it's a very close arm to the, it's one of those agencies that are responsible for, with the help of also the NIH, they are responsible. And the Centers for Disease Control, they are the ones who really conduct a lot of research, try to find out different types of diseases. In fact, if there's any outbreak in any part of the country, you have researchers from the center, from CDC, that will be sent to the place to investigate what is causing the disease. Where is the disease coming from, or where is the microbe coming from? What are people doing to bring for them to be infected? You see, because once they know, then they can give some guidelines as to how to prevent the further spread. See, because even right now, you have some people who are fighting this idea of wearing the mask. But researchers at the Centers of Disease Control have found out that wearing a mask will prevent you from spreading the disease or getting the disease. So it is to your advantage to wear the mask, to keep a distance, especially for somebody you don't know, or it's not part of your family, sorry. Keep a distance, 6 feet. And also wash your hands when you touch things that others have touched. And avoid crowded places. Especially if you are in a crowded place for a long time, the possibility to be infected with COVID is very high. And some of those guidelines are coming from the Centers of Disease Control and Prevention, CDC. So this is the building in Atlanta. This is the place where things happen. The research is done. The guidelines, and also with the help of, NIH also works hand in hand. And yes, CDC works directly hand in hand with the World Health Organization. In fact, you have members of the CDC that have offices in the World Health Organization, so as to continue share their research, share their findings all over, so that if there is an outbreak, right away, you have expertise that can go there, investigate, and find a way to put an end to the outbreak. And these are the ways, some of these offices, you can go through this in your book. Now, operating agencies of the Department of Health and Human Services. You have Food and Drug Administration. They make sure that the food we eat is healthy, and also drugs that are being, administered, or what drugs that are produced are in good form, good for human use. Centers for Medicare and Medicaid Services. Medicare for the elderly. Medicaid for the poor, people who do not have means to be able to pay for medical service. You have the Health Resources and Services Administration, the Indian Health Services, National Institute of Health, NIH, Substance Abuse and Mental Health Services Administration, Substance Abuse and Mental Health Services Administration. So these are all various agencies that collectively are all working with a common goal to improve the health of American citizens. They are broken into different branches, and each of those branches are there to address certain aspects. See, as I said, each of the 50 states has its own health department. This is just kind of health department for Pennsylvania. Or if you go to Richmond, you'll find the health department for Virginia. And you go to any other state, they will have their own health department. And this department will work hand in hand with local health departments in local communities. The state has its own health department, and you have the regional, the communities like Petersburg. Petersburg also have its own health department. And they all collaborate, work hand in hand to address some of the health issues within their respective localities. Now, state health agencies, all 50 states have their own health department. Now, their main purpose is to promote, protect, and maintain the health and welfare of their citizens. See, again, the purpose of these health agencies is to promote, to protect, and maintain the health and welfare of their citizens. The same thing for the government. When you think of the Department of Health and Human Services, is to protect, is to promote, and to maintain the health and welfare of their citizens. So there is a common chain from the federal government to the state government to the local government. They all have the same: to promote, to protect, and maintain the health and welfare of their citizens. Now, it's those departments are usually headed by a medical director who is appointed by the governor. When you say a medical director, somebody with an MD, a medical doctor. Now, purpose is represented in core functions of public health. The core, when you talk of the core functions of public health does the assessment. It does. These are very, very important things to have in mind. That public health, first they do the assessment, they help to develop policies, and assurance, create that assurance based, again, assurance is based on facts, not opinion, based on research. You see, because most of the time we end up having certain things that are opinion. No, public health should you assess. Part of assessment is, what is this? Who is impacted by this? What are some of the factors that contribute to this situation? What is the origin of this disease? And how can we develop policies or interventions to stop this either unhealthy behavior or the disease, and also create, because it works hand in hand with the government as well as with local communities. Now, the core functions of public health and 10 essential services. Core functions. Now you see the core, the assessment, the policy development, and the assurance. Now part of it is assure competent workforce, evaluate, diagnose, and investigate. You inform people, you educate people, and you also empower people to be able to also do those things for themselves that can improve their health. Also, mobilize the community, bring the community together to share resources and address some of those challenges within their community. And also help in the development of policy. And enforce laws. See, because public health also has some legal aspect. See, at times they do inspections. They go to certain restaurants, and if they find it is not clean, they can shut it down. Now you have the system management and research. See, because if you look closely, it starts at the inner circle, which they call the research aspect. Then you have system management. Then it's broken down to all the other, the essential, 10 essential services. The three at the outer surface of the circle: the assessment, the policy development, and assurance. Those are the core, the three. Then you have the essential services in the middle. Then you have the research component. And make sure you really understand this, because something like this can easily show up sometime during the course of this class. So take note of this. They might pop up somewhere, so be prepared. You have state health department, most organized into divisions or bureaus, play many different roles, can establish health regulations, provide link between federal and local agencies, serve as conduit for federal funds aimed at local health department, have laboratory services available for local health department. Then you have the local department, the responsibility of city or county government, jurisdictions often depends on size of population. State mandated services provided locally. Again, the state mandated services provided locally. You have restaurants. They can inspect restaurants, see that they apply, they adhere to the cleanliness and storage of foods, and because one, okay, the quality of the food, is it properly cooked, or because most of the time, these are all things that, again, going back to the main function is to promote, protect, the public health or the quality of health of their citizens. So restaurants are places people go to eat. That place has to be clean, follow all rules. Public buildings are places people go for services. Those places have to be maintained properly. And public transportation inspections, all of this have to make sure that if people are going to use public transportation, those vehicles, the train, the plane, the whatever people, as long as it's public, it has to be safe for the use of people. Detection and reporting of certain diseases. When they see certain diseases in their community, they have to report it quick. Collection of vital statistics. Uh, Birth rate, people and new births, morbidity rate, gender, whatever, those are all vital statistics. Approximately, there are about 2,800 in the United States. Organizations of local health departments. You have a board, then you have the health commissioner, health officer, which usually is a physician, and you have the specialty areas, the environmental health, health education, you have nursing, vital statistics, chronic disease, and communicable diseases. So these are all various branches. Please make sure you understand some of these key things, because down the road they might be very, very helpful. Now you talk of whole school, whole community, and whole child. WSCC model. Schools under category of governmental health agency funded by taxpayers. These are most usually public schools. Schools have great potential for impacting community health. Yeah, when the school condition, the school environment, the teachers are healthy, the school nurse, children are healthy. Most of the time also, that can also help to have healthy homes. So it's very, very, very important. The ecological approach directed at the whole school. See, when you say the whole school, it deals with all the entities, all the parts that makes up the school. Expand on the 8 elements of the coordinated school health approach. Now, the expanded components are, you have the social and emotional, the climate, the physical environment, community involvement, and family engagement. These are all very, very important. You have the quasi-governmental organizations. I think it's better I stop here and make sure you have time to read your book and also listen to the notes. Again, if you have questions, please, you either request a Zoom meeting for us to just, you can Zoom me, or you request a Zoom meeting, or call me by my phone number. I think I gave you, if you look at the syllabus, my phone number is there. Don't allow yourself to be in the dark when the information should be provided to you the right way. Don't allow yourself to be confused. You paid for it. You've taken the time to enroll for the class. Get all that you can get out of the class. If I have to go over things over and over, so be it. Because the beauty of health is you need health for everything. Because without health, nothing counts. So it's extremely important that you really allow yourself to learn as much as you can. Take care and be safe.